Good evening. Thank you guys for coming to my presentation about antibiotics. My name is Erica White. I'm a student at the Mississippi University for Women. I'm a BSN student, and I'm going to just enlighten you guys on antibiotics today. I'm going to tell you all the good things about them, well, not all of them, but the good things and the bad things about antibiotics. Some things that you already know, some things you might not know. Okay. So my objectives for this evening, at the end of this presentation, you will understand the history of antibiotics, and you will understand what they are, a better understanding of what they are. I know everyone knows what they are. You will be able to recognize the importance of antibiotics. You'll be able to state 3 facts about the use of antibiotics and the importance about antibiotics administration. And we will also talk a little bit about how they work and how people become resistant to antibiotics. All right, the history of antibiotics. Alexander Fleming, he was in a lab one day and he discovered what is known as a natural antibiotic in 1928. The natural antibiotic is penicillin. It was the first antibiotic that was discovered that was natural. He predicted back in 1928, he predicted that there would be antibiotic resistance that will occur over time. That was greater than 80 years ago. So 88 years ago, Alexander Fleming predicted that antibiotic resistance would occur. In recent years, antibiotics have become less effective in treating infections, and they have increased in the amount of resistance that they have become. Okay, what are antibiotics? Antibiotics are also known as antibacterial or antimicrobial medications. They are used to destroy and slow down the growth of bacteria. Infections are caused by viruses, which cannot be treated with antibiotics. So antibiotics treat bacterial infections and not viral infections. That's a misconception that a lot of people have about antibiotics. They are used for a wide range of infections. They treat like the common cold, the flu, most coughs. They cannot cure viruses, colds, the flu, and most common colds. Antibiotics are used to treat infections or diseases caused by bacteria in the upper respiratory tract, like UTIs, skin infections, and infected wounds. I know a common antibiotic that we use for most of our patients for UTIs are either Bactrim or Cipro. They use them on a course from 5 to 7 days. They usually take them twice a day. This is the team to talk about what antibiotics are. They can fight certain infections and they can save lives when used properly by either stopping the bacteria from reproducing or destroying them completely. Before bacteria can multiply and cause symptoms in a person's immune system, the immune system usually tries to fight off the infection first and kill the infection. Some common antibiotics are amoxicillin, penicillin, erythromycin. You got Cipro, you got Bactrim, Keflex, and doxycycline. Most of these antibiotics have 2 names, which are the trade name and the generic name. And each antibiotic is only effective for certain infections. I know, like doxycycline, we used to use that in the clinic for wound infections, for long-term, chronic wounds. So people were getting antibiotics IV at home. All right, so how antibiotic works. Antibiotics have 2 ways of working. They work as a bacteriostatic agent, which occurs by stopping the bacteria from multiplying and creating new infections, or as a bactericidal antibiotic, which helps kill the bacteria. The bactericidal antibiotic, it interferes with the formation of the bacterial cell wall. So it kind of stops the bacteria from even forming from producing. And it interferes with the bacteria's cell content. So if the bacteria isn't able to form completely, it will not be able to be an effective, won't cause an infection in the body. Okay, so I mentioned this earlier. Most antibiotics start working within a few hours. They have a short-term use from 5 to 10 days usually. A short-term duration of antibiotic results in similar outcomes of those of longer courses. It is very important that you take the entire course of the antibiotic medication to prevent the infection from coming back or reoccurring. Most people stop taking their antibiotics when they feel better. I'm guilty of it myself. When I feel better, I just stop taking it. But that's not good because that's how resistance to antibiotics occur, and I'll discuss that a little later. Why are antibiotics important? They are powerful medications that fight bacterial infections. They can either kill the bacteria, keep it from reproducing, and they kill or prevent the growth of bacteria, fungus, or some parasites. Antibiotic administration. This is important to know because with antibiotic administration, this is how the doctors help figure out which antibiotic to prescribe. They use what they call a CNS. They'll get like blood work done to figure out what the antibiotic is sensitive to, and that's how they determine which antibiotics to use. They should be used as directed to help prevent resistance. And if an antibiotic is overused or used improperly, there's a risk that the bacteria will become resistant and less effective against that particular strain of bacteria. Okay, so antibiotic administration continued. Antibiotics are usually taken in the home setting orally, once or twice a day. They can be administered or injected. Usually they're injected when you're in a hospital setting. And this is what I was saying earlier about the IV antibiotics. Like people who have like osteomyelitis or like chronic bone infections, they usually get the long-term IV antibiotic therapy. That might be up to like 3 months sometimes, depending on how bad the case is. And if the antibiotics can't cure the infection from osteomyelitis, that might lead to amputation. All right, here's just the picture that I found. It just talks about the unnecessary use or overuse of antibiotics and the misuse. It just has a 40-year-old woman. She's diagnosed with bronchitis. She's prescribed an antibiotic, and it says even national guidelines say that you should not prescribe an antibiotic for bronchitis. They're saying that because bronchitis is viral and not bacterial. And it's showing an 8-year-old boy who's diagnosed with strep throat, and he needs antibiotic. So he's just taking whatever he wants to take. He's taking a small dose, a bigger dose, and he's taking it too long because he's just not taking it right. I don't know where his parents are, but an 8-year-old shouldn't be taking antibiotics by himself. All right, some common side effects of antibiotic use is diarrhea, mild stomach upset, nausea, fungal infections of the mouth, digestive tract, or vaginal areas, which is a lot of those infections are considered yeast infections, like the fungal of the mouth and the vaginal area. Diarrhea. Most doctors will tell you if you have like some of these side effects to not to stop the antibiotic or to give the office a call. All right, this is just saying why some of them, some antibiotics are harmful to your health. Just like I said, they might cause diarrhea. Let's say increase the risk for cancer. Everything causes cancer now. May harm kidney function if your kidneys can't excrete the antibiotic enough, or you don't drink enough fluids. It can cause harm to your kidney, or if you already have kidney failure or kidney harm, or kidneys that aren't working, function properly, they won't excrete all of the medication. It might cause nausea, vomiting, cause a weakened immune system, or might cause UTIs. Some allergic reactions that might occur from antibiotics. Some people, I've noticed a lot of people are allergic to penicillin, and when you're allergic to penicillins, you can't take like any of the penicillin, like amoxicillin, ampicillin, and When you have an allergic reaction to some of these medications, it might be something that happens immediately, or it might be a delayed response. Some side effects of penicillin include a rash, which can be mild, is a mild symptom, and more severe symptoms like swelling of the tongue or difficulty breathing. Like that can actually lead to death if you don't have a clear airway. Use antibiotics in caution when a person has kidney failure or reduced kidney function, reduced liver function, because you can't metabolize the antibiotic in your liver if you don't have if your liver isn't functioning properly. Those women that are breastfeeding, you can transmit the antibiotic to the baby, but usually when you're pregnant, the doctors know which ones are safe and which ones are not. And previous allergic reactions to antibiotics can also occur when taking an antibiotic. Antibiotics work in two ways. There are two types of antibiotics: broad spectrum and narrow spectrum. The broad spectrum are used to treat a wide range of infectious microorganisms, and narrow spectrum only attack a few of the types of bacteria. Some advantages of broad spectrum is that they treat a wide variety, and some of advantages of the narrow spectrum, they won't kill as many of the normal microorganisms. So therefore, you have a greater chance of creating a super infection, or what they call a superbug. How antibiotics work, continuing. I'm almost done with this, how they work part. Some of them attack aerobic or anaerobic bacteria. That's simply saying aerobic bacteria are those that need oxygen, which is anaerobic bacteria. They do not require oxygen to survive. Bacteria become resistant over time due to overuse or misuse. According to the CDC, more than 2 million people are infected annually, and it causes greater than 23,000 deaths. They become resistant. They create what I explained a little while ago, a few slides ago. They create a superbug or super infection. They occur when bacteria changes in some way. Like the bacteria mutates. That's what causes the superbug. They mutate, and they make the antibiotics not as effective because they become resistant, because people have been prescribed the wrong medication or taken it incorrectly, and their body doesn't have immunity or has built resistance to those particular antibiotics. And this is just showing, like, I have this handout for everybody about examples of how antibiotics become resistant and spread. And in summary, as predicted by Alexander Fleming 70 years ago, antibiotic resistance is increasing annually worldwide. So this is becoming like a pandemic problem. Like it was like epidemic, but now it's like a bigger problem, because like it's more people becoming antibiotic resistant, worldwide. Antibiotics are used for bacterial infections, not viral infections. It is important to take the full dose of antibiotics as directed or prescribed by your primary care provider or your doctor.